You've been discharged 3 times, but you're still here. The first time they told you that you were free to go, you actually laughed with relief. You had come in for something so minor, a stubborn infection, some tests, routine blood work, nothing serious, the kind of thing people handle with a few pills and a follow-up appointment. You packed your small bag, signed the discharge papers, and walked toward the elevator feeling lighter than you had in days. But when the doors opened on the ground floor, the lobby looked wrong. The same beige walls, the same tired potted plants, the same security guard who had smiled at you when you arrived. You stepped outside and found yourself stepping back into the same corridor on the 4th floor, right outside your room. The nurse at the station didn't even look surprised. She simply said, "Wrong turn, dear. Let's get you back to bed." You told yourself it was the medication making you confused, or exhaustion, or a glitch in the hospital's confusing layout. You were wrong. You checked in for something minor, routine, safe. That was 23 days ago. Now the days bleed into one another under the constant fluorescent hum, the same soft beeping of monitors, the same smell of antiseptic and cafeteria food, the same pale blue gown that never quite closes in the back. Time here doesn't move forward, it circles. At first, you tried to keep track. You marked the days on a small notepad the volunteer brought you. Day 1, admission. Day 4, first discharge. Day 9, second discharge. Day 17, third discharge. Each time the papers were signed, the doctor smiled and you felt hope rise in your chest like a balloon. Each time you ended up right back here, in the same room, with the same view of the same gray parking lot that never seems to change. The daily reality settles in slowly, like fog. Doctors avoid your questions. When you ask why you're still here after being cleared, they flip through your chart and murmur something about further observation or just to be safe. Their eyes never quite meet yours. Nurses change the subject with practiced cheerfulness. Focus on getting your strength back, sweetie. You start noticing the other patients. Some disappear overnight. The woman in room 412, who always complained about the food, gone one morning, her bed already made with fresh sheets and a new name card on the door. The elderly man who used to shuffle past your room doing laps for exercise, replaced by a young woman who stares at the wall and never speaks. When you ask the staff what happened, they smile and say they were discharged. But you saw the discharge papers for yourself 3 times, and you're still here. Rooms get reassigned within hours. Belongings vanish. Names on doors change. It's as if the hospital smooths over every absence like it never happened. You begin to test the boundaries. You walk the halls when the nurses aren't watching. Every exit door looks normal. The glowing green exit signs, the push bars, the little signs about fire safety. But when you push through, you always find yourself stepping back into the same familiar corridor. Sometimes it's the 4th floor, sometimes it's the 2nd. Once you walked through what you thought was the main lobby doors and found yourself standing at the nurse's station on your own floor, the same nurse looking up at you with that same polite, unchanging smile. You find records showing you were released, signed, cleared. One night you slip into the records room while the night shift is busy. Your file is there, sick now. You flip through the pages with shaking hands. Discharge order dated 6 days ago. Doctor's signature clear and bold. Patient stable, no further medical necessity. Another one from 11 days ago. Another from 18 days ago. All of them real, all of them signed. Yet here you are. The fear that has been whispering at the edges of your mind finally steps forward and speaks clearly. This place doesn't let people leave. The escalation builds in small, suffocating moments. You stop sleeping through the night. You lie awake listening to the soft footsteps in the hallway, the distant beeps, the occasional muffled cry from another room. You start hiding notes in your pillowcase, your name, the date, a short message. I was discharged today. Each morning, the note is gone. The pillowcase is fresh and crisp, as if it never was touched. You try talking to other patients who seem aware. Most stare at you blankly or change the subject. A few whisper fragments, like, they watch the ones who notice, or don't let them see you looking for the door. One woman in the common room grips your wrist so tightly it hurts and hisses, once you see it, you belong to it. Then comes the night you can't ignore it anymore. You confront a nurse, the one who has been kindest to you, the one who sometimes brings you extra juice and calls you by your first name. You corner her in the medication room after lights out and demand the truth. She freezes. For the first time, her practiced smile falters. She looks at you with something close to pity, maybe even fear. No one leaves once they notice, she says quietly, voice barely above a whisper. The ones who accept it, they eventually walk out. The ones who start asking questions, who start seeing the pattern, they stay forever. The hospital needs them to stay. Her words land like ice in your veins. You back away from her, heart hammering. She doesn't try to stop you. She simply watches as you stumble back to your room, the fluorescent lights buzzing louder than ever. You are wide awake now. The truth is no longer a suspicion, it is a fact. You try to leave again that same night. You run down the hallway, bare feet slapping against the cold floor. You push through every exit door you can find. Each time you step through, you reappear somewhere else in the building, sometimes in the cafeteria, sometimes in the chapel, sometimes right back in your own bed with the sheets tucked tightly around you. There is no way out. In the high-stakes climax of your growing terror, you return to your room and sit on the edge of the bed, breathing hard. The hospital is quiet now, except for the endless mechanical hum. You realize with horrifying clarity that you are not a patient anymore. You are part of the building. Desperate, you grab the only thing you have, a black marker you stole from the nurse's station days ago. You press it to the white wall beside your bed and begin to write your name in large, shaking letters. Your full name, the date, the words, I was discharged. But as you finish the last letter, your blood runs cold. The surface already has it. Your name, over and over again, dozens of times, hundreds of times, some in your handwriting, some in handwriting that looks older, faded, written months or years ago. Layer upon layer of desperate markings covering the wall like wallpaper, your name carved in the paint, scratched in the plaster, written in what looks like dried blood in one corner. Every version of you who noticed, every version of you who tried to leave, every version of you who failed. You drop the marker. It rolls across the floor and disappears under the bed. You sit there in the pale glow of the nightlight, staring at the wall that holds the evidence of your own repetition. The hospital is silent now, as if it is holding its breath with you. Somewhere down the hallway, probably a new patient is being admitted for something minor, routine, safe. And tomorrow morning, when the nurses come to check on you, they will smile and ask how you slept. They will bring fresh sheets. They will reassign the room if necessary. Because no one leaves once they notice. And now, the wall remembers you better than you remember yourself.